Welcome and good afternoon. I'm Erica Greenberg, Senior Research Associate at the Urban Institute. I want to thank you all for joining us today for a briefing on the effects of the COVID-19 crisis on young children, early care and education programs, and early educators, as well as on the evidence-backed, equity-centered solutions that can support recovery and resilience. We'll start with an overview of findings and then move into a panel discussion to put findings in context before opening up the conversation to Q&A. The findings we'll share this afternoon come from a consensus-style effort to synthesize the large and growing body of evidence on the effects of the crisis. The effort was headed by Dr. Christina Weiland at the University of Michigan and included lead authors Dr. Daphne Basak at the University of Virginia, Dr. Anna Markowitz at UCLA, Paula Guerrero-Rosada at the University of Michigan, Grace Lutmer at Urban, and me. 20 other researchers and policy and practice partners contributed to the work. Special thanks to Urban colleagues Julia Isaacs, Laura Wagner, and their team, whose list of COVID-19 childcare surveys and data analysis was immensely helpful in this effort. And thanks to the Heising-Simons Foundation for their support of the synthesis and this event. Next slide, please. A few housekeeping notes before I turn it over to project lead Dr. Christina Weiland, Associate Professor and Faculty Co-Director of the Education Policy Initiative at the Gerald R. Ford School of Public Policy at the University of Michigan. This event is being recorded. The recording and relevant links will be posted online after the event. All participants are muted, but you can share questions or comments in the Q&A at any time. Your input will be critical for the Q&A session later in the briefing. We have closed captions turned on. If you'd like to adjust your settings, click the live transcription button at the bottom of your window. And if you're so inclined, tweet questions or reflections using the hashtag #LiveAtUrban. With that, I'll turn it over to Dr. Christina Weiland. Chris.
Good afternoon. Thanks so much for joining us today. We're so pleased to share with you what's been a tremendous amount of work in a short amount of time. We began this synthesis work in March 2021 with support from the Heising-Simons Foundation, and we've endeavored to move really quickly and swiftly as policymakers make recovery and investment decisions. We know the need is great and the time is short. Now it's advancing. This work has really been highly collaborative in nature. You can see our leadership team and broader team here. This work really would not have been possible without their commitment to a fast turnaround timeline and all their brilliant insights along the way. We also were lucky to be joined by policy partners. These are ECE leaders around the country, many of whom have been up to their ears responding to the crisis for 15 months, and their insights really helped us make progress towards our goal of making a product that's really meant for folks making the decisions on the ground. To lead off on the brief itself, I think it'll be news to pretty much no one on the planet that COVID-19 has upended life for young kids and families and early care and education programs around the globe and in the US. Our leaders have had to make high-stakes decisions with significant consequences for young kids and programs that serve them. And at the beginning of the crisis, say April of 2020, they were really doing so in the dark, right? They didn't have a lot of evidence to guide them on what the effects of their early actions were. But researchers internally and externally to their agencies really rallied, and over the last 15 months have written over 300 reports to capture the impacts of the pandemic on young kids in ECE programs, and this is meant to inform some of the decisions that our leaders are making and can still continue to have to make in the midst of this dynamic and fluid crisis. So the goal of our work in this synthesis is to try to provide them with a clear understanding of the pandemic's impacts on young children and learning and on ECE programs and teachers. So to synthesize some of the many reports that we've had come out that they, as leaders, do not have time to, find, summarize, and reflect on around what it means for their efforts. And it should be said, too, that we intentionally have a brief that reviews the evidence on young kids learning and programs together because they're really inextricably linked, right? So we need our ECE programs and sector to thrive for our kids to thrive. We're in the midst two of historic opportunities. So the Biden administration's American Rescue Plan was signed into law in March 2021, and that was the largest public investment in early care and education in U.S. history. The American Jobs Plan and American Families Plan are both pending, but would also provide significant resources in this area. So we're in the midst of a historic crisis, but as the title of the brief puts it, also a historic opportunity. So we did undertake this consensus-style synthesis in which we drew on the insights of 16 leading ECE scholars and 10 ECE policy and practice leaders from around the country. And our goal here was to try to pair research expertise on child development and ECE programs with policy and practice expertise of those with this 15 months of experience of making high-stakes decisions in the crisis. So again, we're trying to get to that audience of decision makers, but bringing into it a consensus from the child development and ECE researchers so that we're speaking with more of a unified voice around where to go from here. What have the effects been and what could we do about it? So our review process for getting to this ultimate list of 307 studies across 48 states and DCs, we drew on, to begin with, the urban list by Julia Isaacs and colleagues that Erica had mentioned, which was enormously helpful. And we added to it web search studies that were in reports we were able to find. We did a lot of reference mining. We reached out to experts for additional suggestions and additions of things we might have missed. We also went through conferences over the last year around what had been presented, what was relevant, what could we find that had come out as reports from those conference presentations. So from there, we applied a screening criteria in which we were looking for, say, surveys that had response rates that were over 30% was one of our criteria. The full details of our screening criteria are in the brief, but this led us to 76 studies, and they represent 16 national contacts, 25 from 31 states, and 31 local studies all told. Now, that doesn't add up to 76 because some of those studies have more than one locality in them, for example, but that roughly is who is represented across the two pieces of the work, which is on kids' educational experiences and then on the programs themselves. This map gives you a picture of where the studies that we included on children's educational experiences and outcomes ultimately came from. And so you can see here that we have decently good representation across the country in terms of state and local settings. And this also included, you can see in tiny print at the bottom, 14 national studies as well. So to give you a summary of the key themes that we found around what's been happening with kids' educational experiences and learning outcomes throughout the crisis, what we had done was pull out key findings from each of the studies that were in our more detailed review and then look across them for themes. And one of those summary themes is that some of the necessary changes that had to be done to make in-person learning environments safe for kids weren't as conducive to learning and social skill development. Hybrid and remote learning, despite teachers' many and best efforts on this front, was really challenging for kids, families, and teachers themselves, and resulted in significantly less learning time and lower quality instruction. Young children's learning and development suffered setbacks during the crisis, and the effects were not borne equally. The children who are typically marginalized in the U.S. education system pre-pandemic, in the pandemic, were more negatively affected. So that includes children of color, dual language learners, and children from families with low incomes. There's also concern that young children with special needs who need supports may not have been identified and may not have gotten the services that they needed to thrive in the crisis. So to dig into some of the specific findings in the brief for these themes, it's really important to start first with what we know about the large enrollment drops that happened from 0 to 5 in particular across the country. And these were not just in the initial shutdown period, they were for the duration of the crisis. So you can see here, for example, on the left, that those are data for Colorado in August 2020 when programs were beginning to reopen. Infant enrollment and preschool enrollment was down over 40%. But then you can look at data points like Louisiana in January 2021, and you can see that 0 to 5 enrollment was still down by 22% in that period. And again, these are just some of the places we have data points from, but they add up to a situation in which kids from 0 to 5, significantly more of them were not in where they would have been otherwise in their 0 to 5 early care and education settings. For K2, kindergarten through 2nd grade, we know that in fall 2020, about half of kids were in remote settings, and we know from surveys of parents of young kids too that they generally were telling us that they were overwhelmed. And so that's the second graphic there, where you can see only about a quarter were saying, you know, I got this, I'm only slightly overwhelmed, or maybe not at all. That lots of families really struggled across the country with remote learning with young kids. The experiences themselves suffered whether or not kids were in person or remote. So across the country, there was less time on learning. So some of the data points that support this takeaway from the broader evidence base: in fall 2020, Louisiana early care and education providers told us that they were only spending about a median of 5 hours a week interacting with remote learners. In Washington State, in K5, only about 19% said kids are spending about the same amount of time on learning as before, and this is in February 2021. One of the other patterns across studies is that program type mattered. So if you were in a center-based program, you were more likely to get synchronous interactions if you were remote in family childcare homes, for example, and that's true too for public pre-K in public schools more so than other preschool program types. Quality decline. So some of the data points here, again, these are just exemplifying this broader trend. In spring 2020, about half of, that's spring 2021. About half of teachers in remote childcare and school-based programs in Virginia reported declines in the quality of interactions compared to about a third of those working in person. And 56% of first grade teachers in Tulsa were reporting it was hard to motivate kids to engage with remote learning. So we have overall limited data on how all of this has affected young kids, but what we do have is not good news. For 0 to 5, we mostly have reports that are from parents and teachers around how children have fared, and we start to see direct assessment data beginning in kindergarten. And this is a snapshot of reading benchmarks from around the country, again, trying to give you a taste of what's in the brief around this theme, what's underneath it. So this is data from Ohio, Virginia, and 41 states that administered tests at different time points across the 2020 to 2021 school year. And so what you're seeing here is pre-pandemic, the percent of kids who were scoring below benchmark on those assessments, and then during the pandemic. And so you can see this stair-step rise across these settings, telling us that kids are not making the same progress that we would normally expect on this really critical early reading skills. And the setbacks are typically larger for groups marginalized in the U.S. education system. This is an exemplar, again, of the broader theme in the literature that's in the brief, but this is showing you for Black, Latino, and white children the percent change in those that are well below benchmark at mid-year in their reading assessments. And this is data from 41 states. And so compared to their counterparts from before the pandemic, all children in these racial categories are experiencing setbacks, but those tend to be larger for Black and Latino kids. And again, you can look at the data that we have for children, for example, who are dual language learners, et cetera, and you typically see this pattern of larger setbacks for those who before were more marginalized. Okay, so in terms of our summary of the evidence on ECE and the workforce findings, this is a map giving you a sense of where the studies that were in our more detailed screen come from. And again, you can see representation across the country, not perfect, and also 8 national studies were in our review. So summary here of the effects. So I'll take you through the summary of the findings and then dig into some more of the specifics that, and there's even more on the brief. So one of the big themes is that childcare centers and family childcare homes are much more affected than public schools and Head Start. They were in much more shaky footing before the pandemic, and those inequities were really magnified during the crisis. Early stabilization efforts did help. There was reports of that across the country, but particularly in childcare centers and family childcare homes, there was substantial need that was left unmet, and the recovery has been uneven. The pandemic increased the complexity and stress of early educators' jobs across all program types in ways that have negatively impacted teachers' mental health. And all that is adding up to a current acute crisis, which is that programs are really struggling to recruit and retain teachers at the same time that parents are expected more and more to be back in work in person. So digging in again into some of the specifics behind those broader themes, we saw evidence of the effects of great uncertainty from March through June 2020, amounting to large financial losses for childcare and family childcare homes and tremendous stress for providers and teachers. They were worried about whether they would still have a job, still have a business, would they get sick, would their families get sick. Across the country too, costs have gone up substantially in care through things like requirements to implement new cleaning requirements, group size restrictions, et cetera. And federal and state pandemic relief efforts have made a difference, but in childcare and family childcare, the data points to limited reach. So in Maine, for example, this is a data point that 30% of childcare programs were able to access the Paycheck Protection Program loans in spring 2020. But when you look within the sector, that was 15% of family childcare homes versus 65% of centers. So unmet need for both, but more so for family childcare homes. In the best of circumstances, teaching young kids is very complex and challenging, and the pandemic has really magnified these complexities. New health and safety practices have meant that a lot had to change, that in-person teachers have had to modify their classrooms and instructional practices and learn how to support remote learners along the way. And you can see here some of an example finding from one study. This is in Boston's community-based classrooms for universal pre-K, just some of the changes that teachers and staff have had to make along the way. In that study, there were over 20 changes that were impacting daily work in the center that were reported. And that's been true across the country, that the demands and complexities of these jobs have really gone up. Teachers are reporting wanting more training on health and safety, on how to address dual language learners' needs, remote learning, and mental health supports for themselves. And on that latter point, teachers are reporting they're really overwhelmed and stressed. So our studies that we have on this topic around the country ask this in different ways at different time points, but the takeaway is pretty consistent that teachers are having a harder time. So in Nebraska, for example, family childcare homes and childcare educators felt negative about the future. That was 70% of them. Really nice data from Virginia by Daphne Busuk and her team has actually pre-pandemic and post and during pandemic data on clinically symptoms that are clinically important of depression for childcare teachers and public school preschool teachers. And there you can see a rise in those who are really struggling with mental health in those contexts. So these staffing challenges are really likely to hinder the recovery. So that's a more recent theme in the work that's emerging. But we know that things like mandatory quarantine policies, illness and family caregiving responsibilities all along the way of the pandemic have led to increased absences in programs that were operating in person, that childcare teachers' job commitment in particular has increased and turnover has increased in the pandemic. And now we're hearing reports and seeing data around the degree to which ECU programs are struggling to find qualified teachers. And it's important to note that ECU is not the only sector that's really struggling to find workers, but it's in particularly poor position without additional help to be able to find and recruit those workers. Okay, so what can help? So our team worked together to identify some potential solutions for mitigating some of these impacts and aiding in the recovery. We really worked with our policy partners to talk through what's actually feasible in their context, and we heard from them loud and clear that they're being asked to do a lot already. No place can do everything, and that these are really different from place to place. So we took this feedback into account and really culled down our list to what you'll then see on the next two slides. And in the brief are fuller details and citations of support for each of these recommendations. So in the first bucket, we have suggestions for what we need to do to accelerate young kids' learning. We know these are really foundational years for laying the brain architecture and the foundation for kids' later success. And so one of the things that resonated with our policy partners was guidance on acting on the best science of teaching and learning. So we know that some curricula are more effective, some ways of supporting teachers like coaching are more effective, and we also know that there are some practices that are common in early childhood classrooms, and there we mean 0 to 8, things like in preschool and in the early grades, like calendar time, like word searches, those sorts of things that really kids don't take a lot of, from. And so trimming those, because we really need to prioritize acting on this best science of what really moves kids to help them get back to where they deserve to be and would have been without the crisis. Making the most of summer. So lots of places have already been very innovative this summer. That needs to continue for the next several summers. There is funding to do so. And these don't mean drill and kill programs. They need play-based, fun, enriching learning. And there are citations that we have in the brief to specifics on the research that points out how to structure those programs. Tutoring has been a really popular suggestion across K-12. And here we point out that this has been shown to be just as effective in kindergarten and is a strategy that districts and localities can consider. Hiring assistant teachers is another one. So kids are going to be entering early childhood settings this fall from 0 to 8 with a wider range of developmental levels and skills than we've been typically used to in the past. So assistant teachers can help with differentiating instruction, with providing more of the kind of small group supportive instruction. And importantly, many contexts already had assistant teachers before, so this is probably the one that requires the least kind of new thinking to implement, although it does require resources. Okay, then supporting the whole child. So we know that children too, from their parent reports and teacher reports, have had additional struggles in the socio-emotional development domain. Some have been out of school altogether. Some have had experiences that have been somewhat interrupted during the crisis. And so here, putting extra weight on development in this area, considering trauma-informed approaches, prohibiting harsh discipline as kids return. Also partnering with families. So a silver lining has been that new virtual options have made it more common that schools don't expect teachers to come to school for things like parent-teacher conferences, that you can use technology to reach parents whose work schedules, for example, may not allow that. So as places go back to in-person learning, continuing those virtual options is one strategy to continue to partner with families around kids' learning. Also considering free tech-based learning supports. So we have several of these around the country that are now free and proven. So that includes Ariel Khalil's work with the state of Illinois that's getting launched, as well as Susanna Loeb and Ready for K. So that's another way in which districts can partner and use some of the new funding to think and rethink work with families. On the ECE side of things, really critical is to increase support to the workforce. We have long woefully underpaid our early educators, particularly those in childcare and family childcare home settings. And so getting to a place in which early educators are paid a living wage, and for those that have the same educational requirements and are meeting the same educational requirements and have the same training as K-12, getting parity policies in place, and that includes benefits. So we heard loud and clear from the evidence that teachers are worried about their health and that some of them did not have adequate health care. So getting to parity too on benefits is really important. There was also a theme across the country in many states that early educators were more likely to be back in person than their K-12 educators, but they did not have the same prioritization to vaccines. And so if boosters are necessary, giving them the same priority is really key. And then accelerating the creation of a coherent ECE system. So we have had a woefully funded system across the country. It's very fragmented for decades now. And so as new funds are available, so expanding options for families for publicly funded ECE options from 0 to 5 is really critical. use public funding to stabilize childcare providers, in particular. Childcare and family daycare, again, were much more affected than public schools and Head Start. At the same time, we do have to anticipate and stave off any cuts to Head Start and the public schools that may be coming because of, say, some drops in enrollment in formulas and how they're sort of set up to work. And then the new funding also explicitly permits investment in data systems and analytic capacity. And so it's going to be very key that we keep an ear on the ground around what's happening to make sure the resources are going to the right place. And that's going to require these greater investments in systems and analytics. So finally, we close the brief with some thoughts looking across this literature around where research can go and how it can continue to try to aid in the recovery. And here we do point out that even though we have over 300 studies, this is a dynamic, fluid crisis, and we're going to need more to make sure that the way that the resources are being targeted are getting to the areas of need and that they're helping support the recovery. There are also important but difficult to study dimensions around which we have very little evidence. And so that includes, studies that really look within the classroom around what children's experiences have been in. We haven't been able to go in like we normally do in many settings to observe curriculum and instruction and socio-emotional learning. And so it's very key that as things reopen, as we have vaccinated observers, that we're able to do so. Also that we're able to get to things like learning outcomes for the youngest children, a better picture on that, how teacher training is going as we try new topics and new help for teachers. Key populations are also very critical. We have very little data on some of the ones you see listed there on the slide, like homeless families, kids who are experiencing bereavement due to the pandemic, Asian American children amid this spike in Asian American hate that's happening nationally. Another suggestion for research is that two very effective ways to proceed could well be a research practiceship and enhanced research capacity within EC agencies. And then quick turnaround studies are really needed to inform local action. So the research community, again, has come up with over 300 studies, so many have very much done this. And so doing this and maintaining rigor while doing this is really key to getting us to a place where we are consistently able to use evidence in the recovery. We have a lot of people to thank with this effort. Some of them are listed here, and we're excited to engage further with folks who are key audiences for this brief and look forward to the panel discussion and conversation.
Great, thank you, Chris, so much for that overview of the findings from the evidence synthesis and for getting us started here. I now welcome two other panelists to join the conversation, turn on their cameras. The first is Miriam Calderon, Deputy Assistant Secretary for Early Learning at the U.S. Department of Education, who's previously led early learning systems for the state of Oregon and District of Columbia Public Schools. The second is Philip Fisher, Philip H. Knight Chair and Professor of Psychology at the University of Oregon. Their perspectives will enrich this conversation immeasurably, and we're honored to have them. Throughout our panel discussion, I'd invite the audience to continue to send great questions and comments to the Q&A, and we'll get to them in a few minutes. First, Phil, I'd love to start with you as an expert in neuroscience and child development, including during the pandemic. Now that you've heard the findings from the synthesis, which children and families have been most affected by the public health and economic crises, and what will the long-term ramifications be for them?
Thanks, Erica. Thanks for the invitation to join. And Chris, thanks for that great presentation and for the amazing synthesis of an incredible body of work that's been done in the last year and a half. The results that you're describing, I think, are very consistent with a lot of what we've been seeing in the data that we've been looking at as well. And in particular, we know that children in many ways are quite resilient and have the ability to withstand challenging times, especially to the extent that the context that they're in involve supportive and nurturing relationships with adults. And when I say with adults, I don't just mean with a biological mom or dad, but with really anybody in their lives with whom they have meaningful relationships, including providers and early childhood educators. And as a result, I think what's safe to say is that for those children who, in spite of some of the ups and downs of the pandemic and the uncertainty that's been introduced, that they've been in places where those supports are in place, that we expect that from a brain science perspective, that those children, even though there may be some initial ups and downs as things reopen and we go back to the way things were in some ways beforehand, that things will be relatively okay. Our concern is that, and I think this was highlighted in Chris's data, that the pandemic was really not an equal opportunity employer when it came to those who were affected. And in particular, what we saw is that the structural inequalities that existed based in particular on race and ethnicity, but also on things like family structure, so single parent households, kids where or families where there's a child with a disability, that the disparities in those households around the economic circumstances really were widened considerably during the pandemic. And why that's a concern in terms of brain development is because we also have found that those experiences disrupted adults' ability to provide care for their children in many instances, and that got passed along to children having higher levels of distress. So I think it's in the context where the greatest structural inequalities and disparities exist that we should really be more concerned about the things that people talk about as toxic stress, where there are potentially more long-term impacts on health and well-being and social emotional development and so forth. But let me just quickly say, all of those kinds of statements that get made, including what I just said, really need to be qualified. There's a huge amount of variability, and I do not want to imply that among groups that have experienced these kinds of inequalities, that means that everybody is going to struggle. It just means that when we think about allocation of resources and supports, that the sooner there's greater stability and less material hardship in the lives of those individuals and in the lives of providers, that's what's going to make the biggest difference.
Thank you so much, Phil, for those great insights. We know there was variability in the impact of the crisis on localities as well and across states. And Miriam, you've been an ECE leader at the district, state, and federal levels. Can you speak a bit to the many challenges the crisis has posed for ECE leaders at different levels of government?
Sure, absolutely. First, I want to say thanks to you and to Chris for including me, and I'm also excited to be on this panel with Phil, who I had the benefit of being a part of RAPID during the pandemic. And so while Chris, it is true, we didn't, not a lot of time to pour through those studies. It was as often as I could get on some of those evening calls to hear what Phil was learning from the research. It was hugely beneficial whenever I could. I will just say that a lot of the synthesis really rung true for me, very consistent with my experiences in Oregon, and as well as the recommendations, I think very spot on. I'll just talk about that. I think speaking from a state leader, being in that role in Oregon, maybe gives some nuance and texture to some of what Chris covered, because I think that the brief did a really good job of synthesizing the challenges, I think, what at the program and kind of school level, and then just talk a little bit more about state, what some of the challenges were at the state level as a leader and a leadership position. But, on the COVID I think at program level, around the COVID mitigation protocols, I think something that wasn't, something that I'll add is that in addition to that, learning how to implement the protocols, the mitigation protocols, a lot of the caregivers and early educators, administrators were also in the place of quickly needing to be the experts for families and other staff around explaining the why behind those protocols. And I think that was challenging as well, because they changed as our knowledge of the virus changed over time. So it was staying up to date on the why. And so we from the state level also had to be experts, get the information to caregivers, and then caregivers found themselves really being the ones that had to answer the questions, including explaining why things changed, right? Why children didn't need to wear a mask early on in the pandemic and why later they did, right? Young children, and the why behind that. And so I think that was at times, very, very challenging. You talked about fear of contracting the virus, and I think the implications for staffing. I think that obviously was very real. We heard a lot about, I think something that just to put a finer point on it, we were very clear as we're providers from the beginning at the outset in our guidance, you know, there is no social distancing with in caring for young children. That is just not going to happen. So we didn't say the maintain 3 feet, 6 feet, whatever it was. It was, you know, you are going to be in close proximity with children, and that is, you know, early on, that is just something that is the nature of the work and is part of your decision if you come back and, you know, if you choose to maintain in this work. I think the fewer, you know, the new ways of service delivery, something that we also heard in addition to the, you know, less contact with families and the switch to remote learning in some types of settings is families. While there were fewer children, I often heard from educators that there were fewer children, but the children that they did have were exhibiting much higher needs. So it felt like they had full classrooms at times. It was very challenging in ways when we did see reductions, when we asked providers to make reductions for smaller group sizes. We heard a lot about how difficult it was to choose among families who they all know needed care, who were essential workers, and have to do some of that prioritization and say, I don't have, you know, I can't serve you. And I know that was very hard for many programs and many providers. At the state level, I would describe it as choosing between, I can't remember a period of time in my career, I've worked over 15 years in early childhood and programs and policy, where I have felt like I was constantly making a choice between two equally, or two bad options, maybe the least bad option. That's how I was described it. I think the first choice was whether to close childcare or not. Once schools had closed, and I think there was a group of providers and educators saying, please close us, schools are closed, we're scared. I'll never forget a post on Twitter from a toddler teacher who said she was going to work and she had 101 fever because she had to. She didn't have paid sick leave. And an equally large group of providers, educators saying, please don't close us. We can't afford to not, you know, to not work. Our businesses won't survive. How do you equitably distribute $30 million in federal stimulus when you know you need double, triple that to be able to replace the lost revenue in the sector? We, at one point in our state, were distributing $80 million in federal funds to over 4,000 providers. We did it in 4 months. The vast majority had never received any public funding from the state. And so how do you do that to providers who don't have the technology, the experience with public financing, who speak languages other than English? And do it quickly because expediency mattered. I talked about translating complex public health information, keeping families up to date about supply. The market was changing so rapidly. We had very antiquated systems at the state level too, but that was so critical and so important, especially periods of time with essential workers. How in real time could you tell families, you know, this is a provider that has an opening in your community at the speed with which they needed it. So I'll stop there. Thanks.
Thank you for sharing so candidly those incredibly valuable perspectives. Miriam, I just wanted to pick up on that point on equity, both for families and for providers. So what can legislators and program administrators do to advance justice among racially and economically marginalized communities?
Yeah, so Erica, as I reflected on this question, I'm going to pick up on the word justice more than anything else. And so taking it from a role of justice, I was reminded of a conversation I had with a former colleague who I think summed it up really well in a conversation we were having. And she said, my people want to be citizens, not clients. My people want to be citizens, not clients. And so I really think when we're talking about communities, people of color who have experienced oppression, we really need to think about power, and we need to think about how we build power in communities. And so I think often, strategies like representation, having people in elected positions or in represented in mainstream institutions is really important. I mean, I'm cognizant of the fact at one time, actually the majority of the time I was working in Oregon as the early learning system director, I was the only Latina in a similar position in the country. I'm no longer in that role. There's one in Delaware that I'm aware of, another Latina. But so, that matters. It's important. I think it's important to have that kind of representation and make that decision sort of at all levels. But I really do think this is an opportunity to think about how we empower communities, how we build power. And there are a lot of strategies that we can look at at this moment. I think, and with this unprecedented level of resources. So I'll share one in Oregon, but I think there's many as we think about building power. In Oregon passed the Equity Fund, which was an investment in culturally specific organizations to deliver services birth to 5, right, to families with young children, birth to 5. And while it was incredibly exciting that we were going to expand culturally responsive services to communities, one of the things that was exciting to me, I think an equally important benefit of the Equity Fund was investing in culturally specific organizations that were led by the very communities that the people that represented and came from those communities that they were serving. Because those organizations, businesses build power, institutions build power in communities. And I think the benefits in years to come, not just of the impact of the families that benefited from those services, but the fact that we will have institutions now that are part of the early learning system that reflect those communities is going to be transformational for Oregon's early learning system. I think you see it even in our administration. Another example is investing in historically Black colleges and universities, investing in tribal colleges and universities, investing in Hispanic serving institutions. We know those institutions are going to build leaders, right? And those institutions are in communities. So I think those are some of the examples. I think, again, there are a lot of strategies, but I think services are important, but I think we need to change our mindsets a little bit beyond services when we think about how we build capacity and build power in communities so that they can change our institutions from the outside and also from within.
Thank you so much, Miriam, for just your incredible perspective and your leadership, and for elevating this point about changing the distribution of power and changing mindsets. So this one's now we can start with Chris and then Phil. The crisis has been devastating, and it really continues to be devastating for so many in our country and around the world. But have there been any silver linings from the pandemic, things that we've learned that will help children, families, and early educators into the future?
Yeah, so we'll start, and I'm really curious, Phil, to hear your perspective. And thank you, Phil and Miriam. This is just wonderful to have your brains on this and to have you with us for this. So I think this point that our general consensus team made around the virtual options for families is really key, right? I think some of the reasons that we have these stereotypes that certain families are not engaged in their kids' education just really comes down to who's free, like who's at work, right? Work schedules and school schedules have a huge misalignment problem. And so I'd say the biggest silver lining has been for schools and ECE settings to just learn how to get families when they're available and to have virtual tools at their disposal for doing so. And so across the data, you do see patterns of high family engagement to the extent that they're able, that their work schedules allow, and it feels like schools have kind of caught up to what's possible on this front. And we know that families and schools need to be partners in supporting kids all throughout. And so this seems to have pushed the envelope on that.
So I'll just add to what Chris is saying, but first and foremost, I want to tag on to the end of Miriam's question, just because I think one of the things that we've learned around equity during the pandemic is about the importance of provider and parent voice. I'm a developmental neuroscience researcher, first and foremost, an evidence-based intervention developer, second probably. And I can say that before the pandemic, even with our really strong investment in doing work that was community focused, that still many of our ideas were ones that we generated and then kind of disseminated into communities. And the rapid survey and all these other surveys that you're hearing about, I think whether they're quantitative or qualitative, are really putting an ear to the actual experiences of families and providers. And I think that's just such a critical tool for addressing issues of equity. It's sort of like this, remarkably simple concept that if you ask people in an honest and open way what's going on and what they need, they'll tell you. And I think that if we do more program design around this, Miriam's done a tremendous job of this in the state of Oregon, that you can design quite effectively. So I think that's one thing that's in a lot of ways, it's a bit of a silver lining, is that we've learned the importance of these tools and of being able to disseminate them rapidly, collect data quickly, and get the information out quickly as a way to address these historical issues of equity. Second, I just want to say the other things that we've been finding have to do with the extent to which, as much as the pandemic has led to social isolation and deprivation, and people are concerned about kids' social emotional learning, it's also brought a lot of families closer. And in fact, one of the big surprises in our data that we found was that not only were people saying that kids are relying more on parents for emotional support, but parents were actually saying that their young children were a big source of emotional support in their lives, much more so than pre-pandemic, where it had mostly been kind of like friends and coworkers. People's social networks got much more local. And so that was sort of a nice example of an opportunity to really see how the kind of the ties that bind really have made a big difference in the context of the pandemic, in spite of the many challenges that people have been facing. And then lastly, let me just say that our data, as we've seen some of the issues around material hardship begin to ease starting around January, as more aid became available. Most of it dried up during the summer and we were in limbo for a long time, but as it began to flow, we've seen levels of hardship begin to drop. They're still high, it's 1 in 4 families, but we've also seen that as hardship declines, that so do the kinds of emotional distress variables that Chris was talking about earlier. They seem to get less as well. So people are doing better emotionally as financial circumstances, as the money that's been allocated actually makes it into the hands of people. And we're really excited to continue to follow families and see what the child tax credit money does as it begins to flow this summer.
That's great, Phil. Thank you. And that's a great transition. So we've got some momentum now beside recovery and resilience. But a question for Miriam, and is just based on the best evidence, how can states and school districts make the best use of available American Rescue Plan funding right now?
Yeah, thanks for that, Erica. Well, I'll say, despite different timelines for spending plans, I hope one of the things that we'll see is that communities will come together and plan together, really. And I think, again, and focus on those communities that we know have been hardest hit for the pandemic. I think as Chris talked about, there's historic, unprecedented levels of funding for schools, flowing to schools and LEAs, as well as for childcare. There's funds for Head Start, early intervention, early childhood, special education. I think we have an opportunity to, communities have an opportunity to think across these silos, right? And to really think about the way these resources are in these communities in place across the different funding. I think, and you hear some of the way that the breakdown is already starting to happen. I know it sounds wonky to talk about program silos and funding silos and things like that. We can do that on this call, but even in just mainstream what we hear, right? When we talk about childcare, we talk about moms not working. When we talk about K-12, we talk about uninterrupted learning, right? I hope one of the things we can talk about, one of the takeaways for all of us should be, K-12, right? Education is care, care is education. Both systems are equally, birth to 5 and K-12 are about both. So moms weren't able to work when K-12 was online, right, or virtual or closed, and vice versa. So I think that there are some recognition, and I saw it in Oregon with schools, right, thinking about family support in different ways, thinking about childcare. We had a lot of school leaders spending a lot of time thinking about childcare, right, and how that was impacting families. And so anyway, I hope that there will be that planning together. I think we know, and as the brief talked about, we're coming back, our secretary is very focused in our administration on in-person, getting back safely, making sure that we can do that. I think paying attention, I hope schools, again, will think earlier. We know we had a third less children served in Head Start. We less service disruptions, as well as less identification. Chris talked about in early intervention, focusing again on targeting resources, children and immigrant families. There are funding, there's specific set aside for children experiencing homelessness, sort of an ARP. So compensation for our childcare workforce, wrapping around families and caregivers. I think that's a big lesson learned in this, and I think the resources are there to do that. So those are some of the areas I hope are a focus.
That's great. Thank you so much. Such actionable steps that states and districts can take now. As we transition to Q&A, one last question for the whole panel. This event and our brief are titled Historic Crisis, Historic Opportunity. What is it about the crisis or our current moment of opportunity that's most important for audience members to take away? Chris, let's start with you, then we'll go to Phil, and Miriam can have the last word.
Sure. I think the thing that I would quickly say is the most important to take away is that we know the sector is currently struggling and we can't recover without them. And that is going to require, as other industries are racing to, fill their own jobs. I know American Airlines had to cancel a lot of flights, for example, in the last 2 days, because our family member was trying to take one because of a worker shortage. And so, we're seeing these in industries across the country. And so any kind of real recovery is going to have to make ground on finally compensating early educators in a fair and sustainable way.
Who's next?
Go ahead, Phil.
Okay. I would just say that the issues that we've been talking about today are ones that almost universally were pre-existing before the pandemic. Issues around sufficient care, around the early childhood workforce, around the struggles that families have balancing work and parenting. All of these things were really an issue before. They continue, and they certainly were exacerbated during the pandemic. But from our perspective, these are issues that are really not, it's not like, oh, it's over and let's get back. It's really, how do we, the opportunity to us is that now that there's an increasing awareness of early childhood and how important it is. And I think some understanding that like kids won't just simply all get over what happened during the pandemic and move on with their lives because they're too young to remember, that it's an opportunity to continue to address these issues and for the current administration to really think about ways that we can promote all of these different dimensions of early childhood, including, and I'm so glad that this has focused on not only families, but on the early childhood workforce, because there's so much intersection there that's really, I think, if we can begin to do that and address these structural inequalities that have existed for so long, we'll be moving in a positive direction, which is a big deal.
Yeah, I would just say, this moment has brought, I think, an attention to many of the issues, as Phil was talking about, that maybe, an attention to a greater attention, I guess, to people maybe who haven't understood the issues in this same way around the challenges for families with young children and the challenges with our early care and education sector in this country. So with this attention, I think that there is a moment. We, as our president talks about, we want to build back better. I think we all agree we don't want to go back to the system of February 2020. And we have this historic moment and opportunity on financing, and we have the American Families Plan, $425 billion proposed to finance early care and education, birth to 5, big compensation, the affordable, accessible building a supply of quality care that is affordable for families. This is a moment, right, to actually build that system and eliminate race, income, and zip code as a predictor of who has high quality early learning and care experiences before kindergarten and who doesn't. So I hope that everybody takes away to transition from ARP to something like the American Families Plan would be game changing. So we have to, it is not a foregone conclusion. It is not a done deal. It's something that we all need to do our part to make happen.
Great, thank you all so much. I'm going to get to some of the excellent questions that have been submitted in the chat in our last 5 minutes. Thanks to everyone who submitted. The first one is on a particular program type that we focused on in the brief and that has long been under-resourced, that's family child care homes. How can this sector in particular receive more funding and support going forward? Whoever would like to start, go ahead.
I would say, Miriam, you're the real expert. As the one who,
sure. I mean,
yeah.
Yeah, I mean, I think I think at multiple levels. I really think about family child care is high quality. I think as the brief talked about, it needs to be supported. I guess I'll say it this way. We talked about in Oregon as quality can happen in all types of settings in a mixed delivery system. I think really the issue is how do we support quality, and how do we build infrastructure and capacities in communities to support quality across a mixed delivery system. And so I think some of the ways that our strategies need to look different, how we think about financing, coaching, professional development. But I think that hopefully we've all understood from this pandemic that they're an important part of our system, of choice for families, of options, and that they need to continue to be supported going forward. And I know they're an important part of the plans as we think about a stronger early care and education system at the federal level that can be resources through the American Families Plan.
Terrific. Thank you, Miriam. It's Child Tax Credit Awareness Day. What can the CTC do to mitigate some of the harms of the COVID-19 crisis among families with young children, and could it even benefit some ECE providers and educators if families have more resources to spend? Phil, we can start with you and then maybe back to Miriam.
Well, we're really excited about not only what the CTC has the potential to do, but also because, as Chris has really illustrated well, there are so many surveys in the field that we probably have an unprecedented opportunity to look at how things actually will be impacted by this. So I think, that there, from what I've heard, can continue to be concerns related to equity, at least at present, in terms of the ability to be able to access the CTC. If you didn't file returns, you have to get to the IRS portal. There are issues around people who don't have bank accounts not necessarily being easily able to get the funding. I think these are things that the government is working on and will try to address. But all of these things, I think, will mean that, as is usually the case, those who in some ways have the least opportunity will probably be less likely and less able to benefit from the funding. So I think that's something that we're going to need to continue to watch. But how it will impact families who are able to get it, and what the impacts will be on child well-being, on provider well-being, and on family well-being, I think are things that we're going to have a really golden opportunity to look at in the next couple of months.
Yeah, I'll just add briefly, I think, to what Phil was saying. So, $3,000 per family for children aged 6 to 7 per child. For children aged 6 to 17, $3,600 for children under 6. This is going to benefit 90% of children in our country, right? In 39 million households. So the issue is, as Phil talked about, is How do we get filers are automatically enrolled? How do we reach the non-filers? There's a resource, irs.gov. I put it in the chat. Hopefully we can get it out to panelists. I think it's gonna really, how do we get the word out, really help people who are non-filers get this information and benefit from this program. And then again, this is only for 2021. So the president has called for continuing this as part of the American Families Plan. So this is an important part of what we need to do to, you know, transform parenting and what it means to be able to, you know, to support families in this country. And so again, this is an important resource and part of a policy agenda that we want for families in our country kind of going forward.
Terrific. Thank you so much, Miriam, Phil, Chris, the communications teams at the University of Michigan Ford School and Urban Institute that helped provide support for this event. And thanks to all of you for joining. We look forward to keeping in touch, and please let us know how the brief and related materials are serving you in your efforts. Thanks so much. Have a great afternoon.